Hello. Let us talk about the virus that is the dengue virus. How it is pronounced dengue or dengue. Which one is the correct? The dengue or dengue? Dengue is correct. So the correct pronunciation is the dengue. This is written as arbo. Arbo is a group of viruses, and it is acronym for AR for the arthropod and BO for bug. So the dengue virus belongs to the group of viruses that is called the arbovirus. So it is arthropod borne. The vector is the arthropod animal, the insect. So the AR means the arthropod and BO for the born. So it is the acronym for the arthropod borne disease. Arbovirus is acronym for the arthropod borne, and the family is the Flaviviridae, genus is the Flavivirus, and the species one is the dengue virus. So it is known as the dengue virus. Classifying the arboviruses, they are classified into three families. The first one, the Flaviviridae, Togaviridae, and Punia variety. The Flaviviridae, the viruses which belong to this family, these are the yellow fever virus, dengue virus, and the hepatitis C virus. So remember which are the viruses which belong to the Flaviviridae. These are the yellow fever, dengue, and the hepatitis C virus. And among the Togaviridae family, the well-known members are the chikungunya. You might have listened about that in the past, that some cases happened in big city, in the Karachi, and so that was in which the rashes appeared on the skin, and this was the chikungunya virus. And the second one is the rubella virus. Nowadays, this is a rare disease, and this is also known as the ruby virus or the rubella virus. Sorry. And the Gunia variety, the encephalitis virus. So these are the three families of among the arboviruses. So arboviruses includes the three families. Another term that is robovirus. Likewise, the arbovirus, there is another term that is known as the robo. So robo is an acronym for the rodent borne. So the robovirus is an acronym for the rodent borne, and these viruses are transmitted directly from the rodents to the humans and without the arthropod vector. So it is just opposite to the arbovirus, in which the vector was present, but in the robovirus, the vector is absent, and they are directly transmitted from the rodents to the human beings. The transmission occurs when dried rodent excrement or waste material is inhaled into the lungs. So this causes the respiratory distress syndrome. let us come to talk about the structure of the dengue virus. The dengue virus contains different proteins, and these proteins or the antigens, they vary from from 1 to 5. So NS means the non-specific. NS means the non-specific. So the non-specific antigens, the proteins, they vary from the 1 to 5. So these NS1 up to the NS5, these are the antigens which are present in the structure of the dengue virus. The dengue virus infects about the 50 to 100 million people worldwide in a year. So it is quite common. And regarding the mortality rate, the dengue fever, the mortality rate of the dengue fever with treatment is less than 1%. The mortality rate with treatment is less than 1%, and without the treatment it is 1 to 5 up to 5% mortality rate of the dengue fever. And when the dengue hemorrhagic fever occurs, the mortality rate reaches up to the 10%. And when the dengue shock syndrome occurs, the mortality rate is that reaches up to the 26%. So from dengue fever, then to the dengue hemorrhagic fever, and then the severe form is the dengue shock syndrome. So there is an ascent of mortality rate from 1% to the 26%. The factors which play the major role in the spread of the dengue virus, these are the factors, the overgrowth or the more populated areas. So the population growth, the rapid population growth, the more population growth, this is one of the factor that plays the role in the spread of the dengue virus. Rapid urbanization, this is one of the factor, and the international traveling from the endemic areas, the areas which are the endemic of the dengue virus. So the travelers, they carry the virus, and so this one is the factor which plays a role in the spread. And the global warming. Global warming also has the role in the spread of the dengue virus. And which are the predisposing factors? The younger ones, the age, the younger ones are more liable to be infected by the dengue virus. The babies and children and women are at a higher risk as when compared to the men. And the diabetes mellitus, those which are with the diabetes mellitus, they have the suppressed immunity, so they are more liable to be infected, and the patients with the bronchial asthma. So these are the predisposing factors. And aircraft for the dengue, the vehicle, which is the vehicle for the dengue virus. So the aircraft for the dengue virus is the mosquito, and that mosquito is the Aedes aegypti. This is one of the kind of the mosquito, Aedes aegypti. As you know that the Anopheles mosquito, that was the vector for the malaria, but in case of the dengue virus, the Aedes aegypti the female infected female mosquito is the vector. So you remember which one is the vector in case of the dengue virus. That is the one of the type of the mosquito, and that is the female mosquito known as the Aedes aegypti. And the mostly the female mosquitoes, they they infect the human beings. So in fact the the females are more dangerous. This one is the fact. And the dengue is the most common insect-borne viral disease in the world. Remember, dengue is the most common insect-borne viral disease. I am discussing the viral disease. So among the viral disease, the dengue is the most common insect-borne disease in the world. So this one is the an encraft for the dengue. This is the mosquito. It is aegypti mosquito that has the whitish spots on the legs as well as on the bodies. And so this is the peculiarity of this Aedes aegypti. And this carries the dengue virus. This is a vector for the dengue virus. Aedes aegypti mosquito. And these are the females. Let us see the Aedes aegypti. This one is the Aedes aegypti. The dengue virus type, there are the different types of the dengue virus. There are the 4 different serotypes from 1 to 4. From 1 to 4. The Den 1, Den 2, Den 3, and Den 4. These are the dengue virus types. Serotype 1 is believed to produce the lifelong immunity, but can be infected with other serotype in future. So in case of the Den 1, the immunity which is produced may be lifelong, but if the patients are reinfected or the recurrence occurs, so the immunity may not be lifelong. But usually serotype 1 is believed to produce the lifelong immunity. So this one is the intraocular, the dengue virus transmission. How the dengue transmission occurs? The 3 factors play the role. The mosquito transmits the virus to the human beings. So the mosquito transmits virus to us, and this is the interplay of the 3 factors: mosquito, virus, the mosquito, the virus, and the human beings. So the dengue transmission cycle has the 3 major 3 factors. So when the interaction of these 3 occurs, the infection occurs. This is the mode of the transmission of the dengue virus. If we will watch out the mosquito which carries the dengue virus, it is an urban mosquito. It is aegypti, it is an urban mosquito, and in this mosquito bites during the day, so the biting occurs during the day. Normally catches us unaware. So this aegypti, we catch it unaware, and it loves or lives in the fresh water in homes. It lays eggs preferentially in the jars, discarded containers, coconut shells, old tires. And the breeding occurs around the year. So the year-round breeding occurs, and the dengue virus is common in the tropical regions like Pakistan, India. So, so it is not our greatness. These are the India and Pakistan. These are the favorite zones. How the dengue virus happens to be acquired by the human beings. So this is the pathogenesis of the dengue virus. The mosquito bites the human beings, which carries the dengue virus, and that virus enters into the WBCs and causes the leukopenia. It causes the cytolysis, the WBCs, they are destroyed, and this causes the leukopenia. And then it is released, the cytokines are released by WBCs or macrophages, and these cytokines, the interferon and the interleukins and the tumor necrotic factor, they lead to the fever, high-grade fever, and this fever subsides after about a week, but the weakness persists, and the recurrent infection is not uncommon. The recurrent infection with other serotypes may occur, and, the severe form of the dengue virus infection occurred. The dengue hemorrhagic fever and the dengue shock syndrome. These two are the severe forms. However, the most cases they are recovered and they are healed up by the infection. But if the recurrence or the reinfection occurs by another serotype, the dengue hemorrhagic fever and the dengue shock syndrome occur, which are fatal conditions for us, for the human beings. Why the secondary infection exposes to us? The secondary infection causes the dengue hemorrhagic fever and the dengue shock syndrome. The dengue fever is a classical presentation of the dengue virus. However, these are the severe forms of the dengue virus infection that may lead to the dengue hemorrhagic fever, the dengue shock syndrome, and they are fatal conditions, and their mortality rate is high. As you know, the mortality rate of the classical dengue fever is less than 1%, while in these two cases, the mortality rate is high. So, these are the fatal conditions. So why the secondary infection that leads to this one, the dengue hemorrhage fever, dengue shock syndrome? How these two conditions occur? The recovery from the classical dengue fever, the antibodies formed against the specific serotype. In case of the classical dengue fever, the antibodies are formed against that specific serotype. When the secondary infection occurs with a different serotype, there is exaggerated antibody formation, and this response is called the anamnestic response. When when there is the excessive or the exaggerated response, the excessive antibodies which are produced, and these antibodies will lead to the immune complex formation or the antibody dependent phagocytosis by the macrophages. So, when the immune complex formation occurs, when the cross reactivity of the antibodies occurs, the vascular permeability is increased, and this will lead to the exudation or transudation, the transudation of the fluids into the different cavities, and this will lead to the the shock. This will lead to the dengue hemorrhagic shock or the dengue hemorrhagic fever. So this is the pathogenesis of the dengue hemorrhagic fever and the dengue shock syndrome. And you should remember that why the secondary infection uh, causes these two conditions, because there is a immunostic response, exaggerated response, antibodies. They are produced and they cross react and they settle down into the microvasculature and they cause the, the, the increased permeability of these vessels, leading to the transmutation in the different cavities such as the pleural cavity and the leading to the ascites or the pleural effusion that will lead to the dengue shock syndrome. So the clinical presentation of the dengue virus infection, these are the simple dengue fever. That is a classic presentation, and this is no more, this is not highly fatal. And the dengue hemorrhagic fever. Dengue hemorrhagic fever is a fatal condition and mortality rate is high. In this dengue hemorrhagic fever, the plasma leak is less than 5%, while in case of the dengue shock syndrome, the plasma leakage is more than 5%. So, so the dehydration occurs in the dengue shock syndrome because the plasma leakage is more than 5%. So what is the presentation, clinical presentation of the classic dengue fever? What do we experience? So there is an abrupt onset of influenza-like syndrome. So the fever is more than 2 or to the 10 days. So this is essential criteria fever. Fever is essential criteria. Fever is more than 2 days and less than 10 days. And flu-like symptoms appear, headache appears. The headache is a retroorbital pain. Mostly it is a retroorbital pain, severe type of the pain, and that is the retroorbital pain. Myalgia, arthalgia, severe backache, severe backache or bone pains. So this is one is also called the breakbone disease. The dengue fever is also called the breakbone disease because the severe backache occurs in the pain in the bones occurs. So this is dengue fever virus infection is also called the breakbone disease. Facial flushing also occurs. Rash is also a typical one, and that is a maculopapular rash all over all over the body. The bleeding manifestations, abdominal pain, and the urinary output is reduced, and the irritability in infants and the enlarged lymph nodes. So this one is the classical presentation of the of the dengue fever. So the bleeding diathesis occurs in the severe forms of the dengue virus infection. So bleeding into the eyes occurs. Bleeding in the skin also occurs. So these are the skin bleeds. And the signs of the significant dehydration in the dengue shock syndrome, the signs of the significant dehydration also occurs because it is a It is a shock. It is one of the type of the shock, and this is a dehydrated shock type of the shock, that is the hypovolumic shock. And hypovolumic shock occurs because there is the escape of the transudate from from the vessels towards the cavities, different cavities. So these are the signs of the dehydration, the tachycardia, decreased blood pressure, and the narrowing of the blood pressure and oliguria. The the urine output is reduced and increased capillary refill time more than 2 seconds. So these are the signs of the dengue hemorrhagic shock. The differential diagnosis of the dengue hemorrhagic fever, the differential diagnosis, which are the conditions which must be differentiated from the dengue virus infection. These are the typhoid fever and malaria, the measles and the influenza. So the typhoid fever, malaria, measles, influenza, and these all are the among the differential diagnosis of the dengue virus infection, because the maculopapular rashes also occurred in the typhoid fever, in the measles, rubella. So these maculopapular rash occurs in these conditions, the typhoid fever, rubella, measles. So these are included in the differential diagnosis of the dengue virus infection. Coming to the tests which are needed for the diagnosis of the dengue virus infection, usually routinely the CBC is performed, the complete blood count is performed, which shows the leukopenia, thrombocytopenia. When the dengue virus infection is diagnosed, the, the CBC shows the leukopenia, thrombocytopenia, and for the bleeding diathesis, the bleeding tendency, we perform the thrombin time, prothrombin time, and the fibrin degradation products and the activated prothrombin time. So these are the different uh, parameters for the bleedings the bleeding to be assessed by these tests: PT, APTT, TT, and FDPS. And the LFT is also important. LFT is also to be seen by the consultants. And the urea creatinine electrolytes, they are also performed, and blood gas analysis, and to assess the plasma leakage, the ultrasound is performed, whether there is a plasma leakage into the cavities or not, the transudate is present or not in the cavities, the ultrasound is performed, and the urine to check protein leakage. So the urine analysis also performed, is to be checked to see the protein leakage. Serology tests, they are compulsory. The if there is acute phase of the dengue virus, we detect the anti-dengue immunoglobulin M. So the immunoglobulin M, if they are present, anti-dengue immunoglobulin, they are present. This indicates, this signifies the acute stage of the dengue virus. And in the non-specific antigen 1, that is also present in the acute phase. So if someone is coming to the doctor in the early stage, the anti-dengue immunoglobulin M and NS1, they are to be advised. And if the patient has elapsed the 7 days or more, then after the 7 days, the anti-dengue immunoglobulin G is performed in order to, to detect they have to coming to the conclusion whether the patient is infected by the dengue virus or not. So immunoglobulin M for the acute phase, immunoglobulin G, anti-dengue immunoglobulin G for the chronic phase or the chronic phase after the 10 to 14 days. So the serology is the preliminary requirement for the diagnosis of the dengue virus infection. The dengue virus, how we will treat the dengue virus infection. Mostly, usually the supporting layers are taken. The mosquito screen. We avoid to be infected by the mosquitoes. So the nets are used. The mosquito screen are used. Some layers are taken in, and the aspirin is avoided in order to lower down the temperature, the fever, we avoid the aspirin. Aspirin is contraindicated, and the other painkillers. The other painkillers they may be given, however the aspirin is avoided. The steroid should not be used. The plenty of water and salt they are taken orally, and children below the 12 years require careful watch for the diagnosis of the which one type of the virus infection is, that is a classical or the dengue fever, hemorrhagic fever, or dengue shock syndrome. Because the children are more liable to get the severe forms. No antibiotics are advised because they have no proven value in the treatment of the dengue virus infection. Antibiotics are not required. Still, there is no vaccine available in the market for the dengue virus infection. We maintain the fluid intake, the ringolec ether or the dexocyline they are given in order to maintain the hemostatics, and the aspirin is contraindicated as I already told you. If there is a severe form of the infection, then we advise for the platelet transfusion in order to block, in order to avoid the bleedings. So the platelet transfusion may be given in the severe forms. Thank you very much. Thanks.